Family planning has been identified as a crucial investment for Kenya's health and development. The large size of Kenya's young population and its rapid population growth are influenced by several factors that have serious consequences. Family planning down. The large size of Kenya's young population and its rapid population growth are influenced by several factors that have serious consequences for the health and development, for the health and well-being of women and children, as well as the country's development. These include early marriage and early childhood bearing, then unmet need for family planning, and high total fertility rate. To address this, the Ministry of Health, with support from local and international partners, aims to remove barriers that impede the access to family planning, information, and services. Major restrictive barriers in the provision of family planning services in Kenya include distance, cost, religion, culture, rumors and misconception, provider bias, and legal and medical regulations. These, these barriers disproportionately affect certain populations, particularly the youth, the unmarried, people with disabilities, the poor, and hard to reach groups, including the pastoralists, refugees, and mobile communities. There has been a significant increase in contraceptive use from 46% of married women in 2009 using any method to 55% in 2014. Analysis of trends by method shows that the overall CPR is driven by increased use of modern methods between 2009 and 2014. Use of modern methods among married women increased from 39% to 53%, while the use of traditional methods over the same time period actually decreased from 6% to 44.8%, despite the overall increase in CPR. The level of unmet need for family planning, which is equivalent to 18%, still remains high. Current fertility rates, that's by 2014, differ from urban and rural areas and across regions in Kenya. The total fertility rate in rural areas, 4.5, is significantly higher than the urban areas. These urban-rural differences in fertility rates are evident throughout all ages. Okay, so today we are going to access family planning information, and we are going to do Today we are going to look at different family planning methods, and we are going to look at the World Health Organization eligibility criteria. So these changes incorporated in these guidelines relate to the following conditions. So recommendations have been made for new family planning methods, subcutaneously administered depot. That one we have medro, cyprogesterone acetate. That is the depot. Then uliprostol acetate, UPA, which is a new method of emergency contraception. Then we have a progesterone releasing vaginal ring. Recommendations have been revised in the following conditions. Use of combined hormonal contraceptives, CHEs, by age, breastfeeding, postpartum, with or without risk of factors such as venous thromboembolism, and women with superficial venous disorders. Progesterone-only contraceptives, POC, and levogestin-releasing intrauterine device used among breastfeeding women. Emergency contraceptive pills, ECPs, use. Obesity added as a new condition for ECP use. Then intrauterine device, IUD, used for women with increased risk for sexually transmitted infections. Then use of hormonal contraception for women at high risk of HIV infection, women living with HIV, and women living with HIV using antiretroviral therapy. So we are going to the specific highlights, and we have community-based family planning. The information on the community-based family planning has been expanded to include methods they are allowed to provide, sources of family planning commodities, reporting and recording, referral of clients, and supervision. Then we have male engagement. Male involvement has been replaced by more inclusive men engagement in family planning. Importance of male engagement and ways of engaging men in family planning are discussed under this topic. Then we have family planning counseling. The content has been reduced and tailored to focus on importance of family planning counseling, informed choice, and informed consent for details on the process of counseling. Then we have discontinuation of contraception. This is a new topic that has been added to give guidelines on discontinuation of contraceptives. Then we have the last one as progesterone releasing vaginal ring. This hormonal contraceptive has been discussed in these guidelines. Availability of this method increases the method mix of breastfeeding, postnatal mothers. So we are going to the different types of contraceptives.